The organisation campaigning for cancer says it's asking medical aid schemes to give their members more time to check changes to their policies to make sure that people are covered for medical treatment. Cancer treatment can be incredibly expensive, especially over a longer term. Medical aids have already published their preliminary changes to their policies for next year, what benefits members get. Many members of medical aid simply accept the changes without reading the fine print. Lauren Pretorius is the CEO of Campaigning for Cancer. Lauren, good afternoon to you. What do you want medical aid schemes to actually do here? What action do you want them to take?
Good afternoon, Stephen. So what we would like is an extension for members to look at what they're being offered this year. What members often forget is that every year they contract a new set of benefits with their medical scheme. So in other words, your benefits change year to year, and every year you need to look that you're going to be having that. Now this year there was a little bit of a delay through a regulatory, and it might have stopped members, taking the time to look at it, waiting for the final approval. So we're asking medical schemes to give their members more time to look at what has now been approved and what the final benefits are that they will be buying for the year 2024.
Do you think most people look at their benefit change notifications, their fine print? I mean, it's like asking people to read the fine print when they get a new cell phone. No one looks at it.
Absolutely not. I'm a medical aid member, and I can tell you when those emails come in, only because I know of the impact and it's something I do every day, I read it. But in general, we feel that things might stay the same. But particularly this year, we've seen quite a change in medical aid benefits, with a lot of the cancer treatments incurring significant co-pays, up to 50%, which is huge amounts of money. So it's really important for patients and members to understand what they're getting and what they're buying. And in fact, they have the right to ask the medical scheme or their broker for actually physically a list of the medications and the type of diseases that and how they'll cover that. It's within their right, within the law, to ask that.
Is there any particular reason why medical aids this year are sort of not going to pay as much for cancer as they did in the past? Has something changed? Does treatment become more expensive?
I think it's a culmination of everything. I think things are getting more expensive generally, with the economy. There is the opportunity for there are less members. We're seeing people buying cheaper coverage and cover, so downgrading into lower benefits. And also there are mechanisms by which we can look at reducing costs of medicines that aren't being taken up by the government. And this is just putting immense pressure onto the entire healthcare system.
The documents that you're talking about, so yeah, they can be quite long. They're written by lawyers who specialize in medical law. Now, I don't understand that language. Do you think most people understand that language, what the language that these documents are written in?
I don't think so. I think that there has been an effort by the medical schemes to make them more simple. But I think the general rule of thumb is when you read something like unlimited or exclusions, those kinds of words should jump out to you, and you should dig deep into those. So words like exclusions, specific treatments, innovative treatment, things like unlimited care. There's no such thing as unlimited care. Be aware of those kinds of words in the material that you're reading. And at the end of the day, Stephen, every medical aid member has the right to go to a financial planner who can help them and make sense of that. You don't have to be left on your own. You have a right to go to a financial planner, a broker, who can explain that to you. If you do not have one, you can go to your medical scheme, and they will appoint a financial broker to you to help explain this to you.
There's a lot that happens with medical aids, and we particularly see people coming under huge financial stress at the moment. So people will go for a lower package, sometimes give up medical aid altogether. And they do this because they have no choice, you know, or they'll keep one member of the family on medical aid, maybe keep the kids on medical aid, maybe keep the breadwinner on medical aid. That must be happening more and more often. If someone's diagnosed with cancer, it suddenly becomes a major problem.
Yeah. You know, and we're seeing, as you've explained, we're seeing a lot more of this. At the end of the day, buying your medical aid is like weighing up any insurance product. So when you insure your car, you look that you don't drive in an area that's, you know, got high theft and so on. So that is what you should be doing with your health, is looking at, am I relatively healthy? Is my family healthy? Can we look at some sort of lower cover for our day-to-day, but still make sure that we're covered for the big things? And a big part of this is understanding your rights when it comes to prescribed minimum benefits. Because no matter what medical cover you buy, medical scheme cover and benefit you buy, you have a right to prescribe minimum benefits. And these cannot be taken out of any of your other medical savings accounts, your oncology benefits, any of your other benefits. They come out of a risk pool, out of the scheme. So that almost gets counted separately. So it's very important to understand, do you have prescribed minimum benefit conditions? Because if you do, that immediately extends your cover. But then again, you need to look at the different kinds of medicine, because it could exclude, there could be the word exclusion on certain types of medicines.
Government has said that it's going to introduce the NHI, a national health insurance scheme. You'll know there's huge opposition to that from the medical aid schemes. There'll be many people in the government sector who are living with cancer. They would really like to access the private sector. Do you think the introduction of the NHI is going to make much difference for cancer patients one way or another?
Stephen, unfortunately, I don't hold out much hope, and the reason being is that the initial focus for NHI will be primary health care, and that would include things like screening and diagnostics, your mammograms, your PSA testing, your colonoscopies, CT scans for lung cancer, all the things you need to test for cancer, and then the initial treatment. And we can't even do that now. So if we're starting to look at increasing that, there is not a focus by government to include these cancer treatments into the basket of primary health care. So we might only see prevention and some diagnostics. But when it comes to the more innovative treatments that are used in the majority of cancers nowadays, I don't see that happening in NHI.
Lauren Pretorius, thank you, CEO at Campaigning for Cancer. Do appreciate the time.